As we do this program late in September, a mandate about all those in child care centers having to be vaccinated or tested on a regular basis, and 2, 3, 4-year-olds with masks. You're confident that that's the right way to go?
Yeah, listen, it doesn't bring me any joy, but it's what the CDC recommends. It's what all of our neighboring states are doing, and it mimics the K through 12 protocols that we have.
What would you do if governor to significantly improve the child care situation in the state, which directly affects people's ability to work and feed their families?
We need to make sure that there's adequate child care services and that people below a certain income level get a tax break for child care services, which can be very expensive.
How severely has COVID impacted the child care industry and, more importantly, the children in it and the parents of those children?
We have been saying since the beginning of the pandemic, no child care, no recovery. If families don't have access to child care, they can't go back to work. If children don't have quality programs, then they also are suffering in their ability to be able to thrive and with their readiness for school.
To what degree has COVID adversely impacted home-based child care?
Really a triple whammy of financial hardships, which is one, the cost of care has gone up. Sanitizing, buying PPEs and things like that have increased the cost of doing business. They have had disrupted revenue, either because enrollment has changed or because parents' ability to pay has changed. And for home-based providers, they have really struggled to access public supports, whether that is the Paycheck Protection Program or other state and federal supports.
The children you serve, what the challenges they face, Doctor, why has it been so hard for so long, for so many of these children and their families to get access to the quality, affordable care they need?
Because childcare overall is just very costly. It's too high, and most of our families are from low-income communities, and so they cannot afford to pay for high-quality early care and education. So it's important for programs such as mine to be around, to remain in existence, so that we can provide the children and families this access that they would not typically have.
That childcare issue, this is an easy fix, all right? The reason why we have the childcare issue, number one, is because our childcare facilities are still at 50% capacity limits on their licenses. The only state in the nation that has that.
And you have an initiative called Talk, Read, Sing. What is that, and how does that connect to helping our youngest children get prepared for kindergarten and life?
It's an initiative to bring resources, tools, and tips to parents of the very young children, 0 to 3, so that they're talking more with their kids, they're singing with their kids, and they're reading with their kids. And these interactions in any language help with brain development and language acquisition.
Help people understand. If someone says, listen, okay, so you don't really do what you need to do is in the first few years, you can catch up later. Can you?
Very smart people have said that age 3 is about middle age when it comes to brain development. So about half of what we expect in terms of those neural pathways really getting laid down and those specific connections being made, about half of that has pretty much been laid down by age 3.
How much of the lack of appreciation, lack of, frankly, respect to those who are on the front lines in child care organizations caring for our children, how much do you believe it is a product of the fact that they are disproportionately women, and many of them are women of color?
The work of caring professionals in general tend to be undervalued. Historically, women tend to fill that particular role. And in the childcare sector, we have women of color that fills that role in a significant way. I think the one thing that we have to start is to recognize that childcare providers are professionals.
It's very apparent that the key to providing a childcare system for families and for our state is the staff. We have to engage staff. We have to prepare staff effectively.
The women who generally are working in centers can't even afford to send their children to the centers that they are working in or others without some level of subsidy help.
We're using the expression reimagine childcare. We've been doing it for a couple of years now. What does that mean to you?
Fund early care and education as a public good. The same way we fund K through 12, you should fund 0 through 5.
So there's a lot going on right now. And this is why I'm super thrilled that there's a lot of ruckus going on right now, that the advocates are coming together, that we're fighting for our children.
Let's not forget that New Jersey is getting $700 million of federal money specifically for childcare, in addition to money that's going out to local communities, to the school districts that could be used for childcare. We're still waiting for our state to put out what its plan is for that money.